The British Prime Minister Boris Johnson plunging England into a national lockdown last night, all in a desperate bid to keep the coronavirus at bay while vaccines are being rolled out. Primary and secondary schools will be shut from today. University students are being told to stay home and study remotely. Non-essential retail, all hospitality, gyms, swimming pools have been ordered to close across the country. Let's give you a bigger picture. Olly Barratt is our UK correspondent in London. Olly, good afternoon to you. Little choice, I guess, but the decision is predictably coming in for some criticism.
Yes, Boris Johnson being criticised for the third time having instituted a national lockdown for having done so too late. His critics say the evidence had been mounting for some time that one was going to be needed and wonder why he waited until this point. Boris Johnson and the government insist that they've been looking at the scientific advice, and it has only recently become completely apparent that a national lockdown was going to be needed, including the closure of schools, which the government says they were trying to avoid as long as possible. The difficulty, though, is that as recently as Sunday, Boris Johnson himself was saying he wanted as many schools to be able to stay open as possible. He's previously described education as a national priority in terms of keeping things open throughout the pandemic. But then on Monday night, he announces that schools are closing when some of those pupils have gone back to school for just one day to see their schools shut. So, yes, you're right. A great deal of criticism for Boris Johnson about the timing of this announcement.
The vaccination programme, of course, continuing apace, but again, at least you're being vaccinated in the UK. We're still to begin the process in South Africa, but also questions being asked about the speed.
Lots of questions, because that was one of the key points in Boris Johnson's address to the nation overnight, was that he was saying, look, we're doing one more lockdown here, but we can see the light at the end of the tunnel because the vaccination is already underway. He said that the UK has already vaccinated more than the rest of Europe put together, and he put a target on all of this as well. Boris Johnson saying that by mid-February he wants all of the people in the top 4 priority groups for vaccinations to have had their first dose. So that is everyone over 70, health and social care workers, care home residents and the clinically vulnerable. Boris Johnson saying that if that can get done by mid-February, then you really take a lot of the risk out of this in terms of hospitalisations and fatalities, and can therefore start to unwind some of the lockdown restrictions. So that becomes critical in terms of how the government's handling of all of this is going to be viewed. If those targets can be hit, then this is going to be a lockdown that perhaps can start to be unwound come the end of February, perhaps early March. If not, huge questions are going to be asked about why the government didn't roll it out more quickly.
Olly, just finally, the country's health minister saying, and I quote, he's incredibly worried about a new South African variant of the coronavirus. Let me put the caveat there that it's not proven that it has its origins in South Africa, that experts fear might not be caught by the current crop of vaccines. What was Matt Hancock actually saying?
Yeah, Matt Hancock actually is praising the cooperation that he has had with his South African counterpart and from South African scientists. We've heard a huge amount of praise coming from the UK about the South African genomic surveillance capability, and there is also a suggestion that the reason the UK has found its new variant and that South Africa also has one identified is partly because those two countries have very good genomic surveillance capability. But the UK is worried about the South African variant getting to this country and spreading further, along with the new UK variant that is already here as well. Yesterday, the government saying that 2 cases that were identified in the UK of the South African variant, if we can call it that, are still the only 2 cases that have been found, and the government certainly wants to keep it that way. Scientists here, as well as in South Africa, are looking at the new South African variant and trying to work out exactly how transmissible it is, but also whether it might be resistant in some way to the vaccines that are already being rolled out. There's no evidence at the moment that it would be, but scientists working as quickly as possible in tandem with their South African colleagues to try and establish that one way or the other.
Olly Barratt in London, thank you.